Hi, my name is Dr. Ken Kaplan, and I am an ear, nose, and throat doctor with ENT and Allergy Associates in East Brunswick, New Jersey. It is now approaching late October, and the air is getting colder, it is getting drier, and that means that nosebleed season is upon us. There are a number of reasons why nosebleeds would occur, so I'd like to talk a little bit about that and a little bit on prevention. We'll talk about management of nosebleeds in another video. First of all, the front part of the nose is generally where nosebleeds occur. As I've already mentioned, dryness of the air causing ulceration of the mucous membranes up at the front of the nose is a major factor in nosebleeds. Plus, there are some very superficial vessels, blood vessels, that are at the front part of the nose, mainly on the inside wall along the nasal septum. And they can be very, very vulnerable to getting dried out, ulcerating, and bleeding. Additional factors would also include high blood pressure. If the blood pressure rises generally above 150 or 160, a bloody nose serves as a very, very valuable red flag that there's a problem that needs to be addressed. Additionally, medications that thin the blood can also contribute to nosebleeds. The most obvious would be aspirin. Even at low dose or baby aspirin, 81 milligrams, that still has enough of an impact on our blood platelets that will promote bleeding and take a person who would only have maybe a little bit of spotting on a tissue when they blow their nose to somebody who's actually having, frank nosebleeds. Other medications would include Plavix. That's also something that impairs platelet function. And then there are anticoagulants like warfarin, also known as Coumadin. And then there are the newer medications like Lovenox and Brilinta, Pradaxa, that affect the blood clotting proteins. So these are all reasons why people might develop nosebleeds, especially this time of year. As far as prevention, keeping the nose from getting too dried out, I like the use of saline nasal gels. You just gently swab it in the nose, anywhere from once to three or four times a day if the nasal mucous membranes are getting very dry. There are also saline mists, but those evaporate fairly quickly. I don't find that they work quite as well. And then there are some specialty products out there that are available as well. So be wary. Nosebleeds happen this time of year, and I will be talking again very soon about how to manage. Thank you.